We're going to begin, though, with breaking news, health news we're following this afternoon. Stunning news for families at 3 local pediatrics offices in Macomb, and Oakland counties after a healthcare worker tests positive for tuberculosis. State health officials have confirmed patients at those pediatricians' offices may have been exposed to TB.
They are Lakeview Pediatrics locations in Macomb Township, Rochester, and St. Clair Shores. A healthcare associate working at those offices was unknowingly infected and may have exposed patients. We are following multiple angles of this story. Paula Tutman is at one of the offices in Macomb Township getting reaction from patients.
Let's start things off, though, here at 5 p.m. with Dr. Frank McGeorge with what we know. This is quite serious, Doc.
Absolutely, Devin and Kimberly. Patients may have been exposed between April 1st, 2019 and January 9th of this year. Now, because of privacy reasons, state health officials will only confirm that the associate diagnosed with pulmonary TB is receiving treatment and is not currently working. All other associates and providers at the practice have been tested and do not have active tuberculosis. Ascension has specifically identified patients that were seen at the specific offices, as well as times when the infected healthcare worker was present, and is sending more detailed notification to those patients. Testing is being offered at no cost to those who may have been exposed. Now, TB is a treatable bacterial disease that is spread through the air from person to person. Many people who become infected do not have any symptoms at first. The skin test is the easiest way to identify people early and begin treatment before more serious illness develops. Because this was a pediatric office and one of the highest at-risk groups are babies and young children, anyone who receives notification of possible exposure needs to take it seriously. Now, with an exposure window so large, everyone is wondering why it took so long for patients to be notified. Now, the state says they began an investigation in November after a case of TB was reported to them in a different patient. That investigation led them to the pediatric practices where employees were then recently tested for TB, and one of those patients tested positive. Our Paula Tutman is outside the pediatric office in Macomb Township where parents are reacting to that news. Paula.
Hi, Dr. McGee. Thank you so much. So this is probably a well-known location to a lot of parents. Business is very, very brisk. I've been on site all day talking to parents. I actually went inside the office and heard a receptionist grappling with phone calls. They're getting lots and lots of phone calls, and certainly parents are very, very concerned because they feel like, at least the ones I talk to, feel like they're not getting information, they're not getting enough information, and they don't understand exactly what's going on. Bill Lobb was shaking as he left the Macomb Township office of Cornerstone Lakeview Pediatrics with his sick 16-year-old daughter. She's had a cough for more than a week and a half and fevers as high as 102. On his way into the office, I asked him if he knew about the tuberculosis investigation tracked to this medical office. He asked about it when he got inside.
I asked the receptionist what was going on, and she told me that I would have got an email from their office if there was a problem.
So he did a little investigative work on his cell phone and quickly found out that this office and the companion Lakeview Pediatrics practices in Rochester Hills and St. Clair Shores are all being investigated by the state for a confirmed case of tuberculosis with a staffer who traveled between the offices.
Unknowingly, this individual was ill with TB, and as that was the case, we are making sure that people are aware of this, and Ascension has sent out letters and emails to all patients who were seen between April 1st, 2019 and January 9th of 2020 when this individual was working.
Yet Bill says when he walked into the Macomb County office this morning with a coughing, feverish teenager, he was given scant information and no sense of urgency for a follow-up blood draw for his daughter.
We discovered that my daughter had been at this office during the time period in question, and that made me upset.
Did they say to you, should we test her for TB?
They didn't say that, but I had already asked for it, and they said I would have got it. I should get notified from the health department to bring her in for testing, but we haven't received anything yet.
Okay, so the Michigan Department of Health and Human Services, they explained in a news release today that they are trying to get Ascension, which owns this group, to reach out to patients to let them know that they need to be tested for possible exposure. But coming up at 6 o'clock, we're getting word, not possible exposure, but exposure and infection in an infant. And we'll tell you what we know about the patient coming up today at 6. For now, I'll throw it back to you.
A lot of scary parents probably hearing this maybe for the first time. But even though TB testing can identify when somebody has been infected, there are still some finer points to discuss.
Yeah, so once the TB bacteria enters your body, it might not cause a serious infection. Basically, you just might not have any symptoms. And it's also important to know the skin test does not become immediately positive. It can actually take a month or more. So in some cases, there might be closer follow-up needed over a longer period of time. That's something that the individual patients that might have been exposed will be notified of.
And while you're not symptomatic, though, you might be contagious still, correct?
Well, usually you have to have a cough and actually have systemic symptoms before you are contagious. So it's more just latent in your body at that point of time.
All right, more coming up at 6.
Yeah.
Thanks, Doc.